Welcome everyone, and thank you for joining us for our Equity Symposium Day. I am really excited to introduce for this presentation, NACM and CAM, Putting Anti-Racist Principles into Action to Support Indigenous Families, presented by our own Claire Dion Fletcher and Alix Bacon. Claire is the co-chair of National Aboriginal Council of Midwives, and Alix is our president of the Canadian Association of Midwives. Again, we will leave about 10 minutes or so at the end of the presentation for some time for a question and answer. And please leave your questions in our public chat. You're probably familiar as well that there will be a survey that will pop up about 2 minutes before the end of the session that will allow you to provide us with continued feedback. Thank you, Alix and Claire, for joining us.
Thanks, Trish. I don't think I want to say that much more of an introduction. We'll just kind of get right into the thick of our presentation, but I did just want to say that I am a Potawatomi and mixed settler registered midwife, and I work and live in Toronto, though I'm coming to you today from Ottawa.
And I'll take a brief moment, maybe just to talk about my positionality. I'm a white settler midwife, and I am first generation Canadian. My family came as immigrants from Northern Ireland in the 60s. They came because they wanted to avoid the troubles caused by colonization there, and the really unfortunate irony of that is they had no awareness of how they escaped colonization and took advantage of it to become settler colonizers. I live and work and play on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. And this partnership is really part of how I try and live into my responsibilities to reconcile a relationship. I don't know if I'll say too much more than that. I'm neurotypical, I'm cisgendered, I'm queer.
Okay, so we were just talking before quickly about like in our little waiting room about Nanki's presentation and how amazing that presentation was, and what a great kind of segue into this presentation it was. So I'm gonna very quickly just give a little talk about why we think the work, like what we're going to talk about and why we think this work is important, though I think Nanki's presentation was the kind of best description that we could give about why this work is important. So I just want to acknowledge that we really are, like, we're all here today because we think this work is important, right? I think if you're going to attend a conference on health equity, then you think this work is important, you think it's needed. So I just wanted to acknowledge that first, and that we're really going to talk today, Alix and I, and it's going to be kind of a casual conversation about the ways that really CAM and NACM kind of have worked together in the past, the relationship that we have, and how kind of as current leaders, Alix and I interact with the organizations and the system and the partnership that has been created for years before we were part of our leadership, and that putting anti-racist principles into action, we understand it isn't always easy. You know, we all may participate in trainings and teachings and think these things are important. We don't always talk about how we actually do them. And I think that's an important thing to talk about and to think about, like, what does this look like and how do we interact with each other as Indigenous and non-Indigenous people to address anti-Indigenous racism? And how do we interact as a non-Indigenous and Indigenous organization together? So that's really what we're here to talk about with you today, is some examples of the way that CAM and NACM work together, how Alix and I work together, and we're going to have a conversation about some of the initiatives that we have worked on in the past year or so, and really talk about them, how they work, and the mistakes that we've made along the way, and how this relationship has formed.
Awesome. Thanks so much, Claire, for leading us in. So when we were conceptualizing, and Nat helped us a lot with this, Nat Pambron, how we were going to share with you today, we kind of thought we'd start at the big mega level, thinking about our international work, and then we're going to bring it right down to our personal work that we do in this relationship. And I do want to thank our translators, Esma and Fern, just as an aside, because I think putting them through their paces with having no notes or slides for them to prepare with. So I do want to thank them so much for that. So starting at the top, maybe, this year was an ICM Congress, International Confederation of Midwives, if there's any non-midwives around. And it was virtual, and NACM put forward a position statement for the second time on the partnership between Indigenous and non-Indigenous midwives. And the way the position statements work at ICM is they have to be adopted by a majority of the member associations. And then once they're adopted, they compel member associations to adopt the position. It's a little indirect in terms of how do you compel ICM to do something. But we had the goal, particularly, I think, of influencing ICM. So maybe I'll let Claire speak a bit more to the history of that, because I came in very late in the process of this position statement.
Sure, thanks, Alix. So the position statement was started actually by Natalie Pembron. She did a lot of the initial work of putting together this statement, and the statement is really about supporting Indigenous and non-Indigenous midwives, about Indigenous and non-Indigenous midwifery partnerships is what the statement is about. And so we really felt, especially at NACM, we felt the need for ICM to think about and to question and pay attention to, and really to change how in the process of trying to expand midwifery and really improve the recognition and acknowledgement of midwifery as healthcare providers, we've actually had the effect of erasing Indigenous midwifery. And, I think Nanki talked about this a little bit in the last presentation, in that this is what can happen when you are becoming a regulated and health profession. And in order to really gain credibility and acknowledgement by the medical system on an international level, that some parts of midwifery and some midwifery knowledge has been erased and is no longer recognized as midwifery. And a lot of that is in Indigenous midwifery, and the erasure of Indigenous midwifery knowledge and practices and systems and ways of governance and ways of regulating ourselves in order for the professionalization and regulation of midwifery on an international level. And so really we wanted this statement to be able to talk about acknowledging that has happened, and how do we move forward from that? So how do we partner with other organizations, and how do we recognize the Indigenous midwifery that we have played a role in erasing, in order to ensure that we stop erasing it and we change our intention and we change the story that we are telling. And so that is really how the position statement came about. We first put the position statement forward in 2017 and got some comments that there wasn't enough international interaction with the position statement. So NACM worked on advancing the statement after ICM, when we had an Indigenous gathering with international representation. And then throughout the following years, NACM and CAM worked together to speak with other Indigenous midwives and other midwifery organizations to advance it to the point where it came to the ICM this year and was accepted. So that's a little bit about the history, and then I'm going to hand it back over to Alix to talk about some of the road bumps that we kind of came up with and the importance of the position statement from CAM's perspective.
Yes, so I think that the position statement is really important in that it's calling on ICM and all member organizations, ourselves included, to really honor the UN Declaration on the Rights on Indigenous People, and particularly that looks at recognizing and our responsibility to support the sovereignty of Indigenous people. And that relates to their ability to create their own educational systems and health institutions, to have funded those in reparations, and as well as ensuring equitable access to our Western clinical medicine. And herein lies maybe the biggest sticking point, in that certainly at the ICM level, Indigenous midwives are often lumped under this term traditional birth attendant. And there's this big push to have midwives have this regulation, this controlled professional title and scope that differentiates them from traditional birth attendants. And so a lot of member associations felt really threatened by this position statement, because they felt that if we recognized Indigenous midwives, we were recognizing traditional birth attendants, and we were muddying the waters, and that it would decrease our credibility. And so I think this is a really common roadblock to doing this kind of work, is people feel threatened and they get defensive. And as well as people's prejudice come up, because when we were working to garner support for this in advance, and we were meeting with different midwifery associations where we thought we might find allies in this work. For example, one association expressed concern that if they recognize Indigenous midwives, that they'd have to then probably recognize Black granny midwives in the US, and they didn't want to do that. And that was why there wasn't support for our position statement. So through the process, we're constantly encountering systematic racism as well as overt racism. And that's one of the difficult things, because then I had to think about, am I calling these people in? Am I calling them out? And how am I going to do it? And how am I going to hold them accountable? And me constantly being aware of the violent thoughts. Like, I really started to hear things differently, awful, violent things that people would say, that Claire and Natalie would be subjected to hearing these comments and ideas over and over again in the process. So I'm gonna maybe...
Can I jump in for a second, Alix?
Yeah.
Just to say something about that. And I think one of the ways that we were able to work together through this is, so we had lots of meetings outside of the actual ICM meeting with members of like ICM executive, staff. We had them with other associations, and, you know, really trying to answer some of these questions, right? And really get at like why the position statement is important, how we felt that we can find a way to support Indigenous midwifery internationally without, I was about to say without threatening, but I think actually, like, I don't know if we actually can do that, but that it's time to think about how we need to share power in midwifery and in the midwifery profession, and ensuring that we're not erasing other important midwifery knowledge and work. It's hard to do, and it makes people uncomfortable. And, you know, there was a comment at one of the meetings about how you know, somebody said, I support Indigenous sovereignty, but I don't support this statement for these reasons. And, you know, mostly about feeling threatened and worrying about how it would affect you, other people. And I think we really need to think about these things, and we need to think about how our discomfort and unwillingness to change things, why we feel that way. And I think it's really important for people to be able to get to talk about them and to say things, but then, and to express their concerns. But then you also have to be willing to hear when people come back and tell you why that's not okay. So, you know, in this instance, I think it's not supporting Indigenous sovereignty to wait until you're comfortable. It's not supporting Indigenous sovereignty to wait until it doesn't affect other people and non-Indigenous people. That is in fact not at all supporting Indigenous sovereignty. And that was an important point that we, I think, continuously had to make in this process, was that you can't just wait until you're comfortable or until you feel this doesn't affect you, because it's affecting other people. And we need to think about how it is affecting other people and how we lift each other up. And so to bring it back to like our relationship between CAM and NACM, I think one of the important things was having a seat at the table and having a space within ICM to be able to have these meetings and to have these discussions. And one of the ways that came about was because we, as a CAM board, recognized that the members who should be representing CAM at ICM should be the president and the NACM co-chair. And then also having the support of Alix at all of these, and the CAM, as the CAM president at the majority of these meetings. And by support, I really mean Alix was there, right? So it's not always Alix speaking, but it is having another person who is a support, like, you know, that they support you, you know that the organization is behind you, you know that you have that support. And quite honestly, you know that you have the support of a non-Indigenous organization to also say, these things are real, we have to address them. And I think that actually goes a long way with other organizations in trying to advance things. And that is one of the things that you can do as allies, is just physically being present and supporting when the non-Indigenous organization or person has asked for your presence.
Yes. So, you know, in terms of the work that I would do in this regard, it would be things like making sure that Claire was at all the meetings, making sure that Claire was copied on every email, and copying isn't enough, making sure that Claire was recognized, that emails need to be addressed in this regard to Claire and I, because we are the two representatives. So that's a really important way that we work. And then I'd say not leaving all the work to Indigenous people. So this statement wasn't my statement, but there's no reason why I couldn't, for example, take a first attempt at writing a draft backgrounder and give it to Claire and Nat to look at as an example of a way that I could do lifting without centering my voice. I can see a question here. I just thought we'd maybe answer in real time about, could we have examples of why people wouldn't want to support the position?
Yeah, I think, and I'll give a quick example, and then we have, I'm just cognizant of time and making sure we get to our other examples. But I think, you know, it's, sorry, I just need to think of really why people felt this way, but it's hard for me to say why, because I was clearly in support of it. But I think there is a real feeling of being threatened, of like the position of midwifery being threatened when we are trying to advance a system that is different than what people are used to. So the statement was about supporting Indigenous midwifery, but it was also about supporting the recognition of community education and regulation of midwifery. So similar to what happens in Ontario with exemption midwifery. And when people have, as somebody made a comment in the previous presentation about the medical system and how the medical system has pushed out midwifery. And I want to acknowledge that it has taken a lot of work to get midwifery to be recognized and regulated and funded, and that in different parts of the world, we're at different levels of that happening. And so when we are asking people to think about how that system of coming about erased Indigenous midwifery and how we might now support the growth of midwifery, I think it concerns people and it frightens them. And it's not without importance, those feelings, but we also have to, they can't hinder us. We have to talk about them, figure out how to work through them and move forward. And we can't continue to advance midwifery through the erasure of other forms of midwifery. And when I say other forms of midwifery, I'm talking about what other people would call traditional birth attendants or traditional knowledge or lay midwives. And so people whose knowledge isn't being recognized as midwifery knowledge.
The other sticking point, and we don't have time to unpack it because it would take another 25 minutes, was that the ICM really wanted us to define what an Indigenous midwife was, and to make it clear what the distinction between, I think they hoped we would distinguish between a TBA and an Indigenous midwife. And we refused to define Indigenous midwife because that's not our place. Indigenous communities will define for themselves how they view an Indigenous midwife. And, ICM can do the work of consulting with a broad range of Indigenous communities, but that wasn't appropriate for this statement. So that was another area of pushback. And the pushback, I'll also say, was quite regional. Not to say it wasn't broad, because it was, like, we passed with 66%, but there was, for example, not one association that supported us from Latin and South America, to give an example.
So then to segue us into our next example, I am also just going to say that it's important that, like, this process was hard and it was difficult, and but we went through it, we worked through it, we got the position statement passed, and ICM has committed to a working group that will implement the position statement and to really actually think about how do we put the position statement into action, and how do we ensure that we actually do what the position statement says. So Alix, I'm going to hand it over to you to talk about the anti-harassment and anti-discrimination policy.
Okay. So CAM has an anti-harassment and discrimination policy. It was long overdue for updating. And so our governance committee took a hand at updating it, and they presented it at our last intensive together in the spring. So that was in June. And it just so happened that day that we had our second board workshop with Stacey Alderwick. And some of you might have taken Stacey's anti-racism workshops through CAM, or she's done a lot of work with AOM. So you might be familiar with her there. But it became really evident to us coming out of the workshop and looking at that policy that we had to completely rethink that process. So particularly when we're thinking about a policy like this, I think the big question is, who are we writing this policy for? And who are we looking to protect? Because a lot of the boilerplate versions of these are about, I think, at the heart, protecting the organization from being sued. In BC, we call it Work Safe BC, and I don't know the different bodies that you'd call it in other jurisdictions, but are we trying to protect the organization, or are we actually trying to protect staff and our members and promote justice? And if our goal is to promote justice, then is it accessible? So we had to rewrite, because it was really legal language and it wasn't obvious what it meant. Taking a trauma-informed approach, recognizing how the lived experience of the person making a complaint is. And the other piece that was really important for us was, how do we address the roots of oppression? Because I think a lot of anti-harassment and discrimination policies take a bit of a bad apple approach, that this person was bad and we're going to reprimand them and then it's all going to be done. But that's placing the blame on the individual. And what we really wanted to discover was the way that CAM's organizational systems have led to the issue, to discover the structural racism and oppression inherent in CAM, because we know it's there. We know CAM has played a part in marginalizing Indigenous and Black groups of midwives and their histories. So if we're really going to make changes, how can we take systems level learning and responsibility? And that's really about reconciliation, right? Like changing how we're in relationship. So maybe I'll pass it on to Claire now.
Yeah. So I think, one of the things that we really thought about in writing this and really became apparent, I think, and particularly, I think, because of the time when we wrote the statement or the policy, and because what the policy is about, and, because as an organization, CAM has been thinking quite a bit about this, but it really highlighted how we can really easily get into, and how we function, just in general, unless we actively resist it, a colonial model of work, and that many of our governance structures and particularly many policies and policy writing, are based in colonial models, and that we really have to actively think about how we work against that. And that if you're not, constantly questioning, how do we do things differently? How do we change things? Then you can easily fall into, even if you have the best intention, and even if you are thinking about this in all other, we're thinking about it in terms of governance and the board and how we interact and how we hold meetings. But then we wrote the statement and we didn't really think about it when we wrote the statement. And so I think, one of the things that really highlighted for us was just like really needing to actively think about these all the time, and to think about how we're resisting colonial models of working together. And, it also, I think, brought into question some more things around like governance and how do we see NACM fitting in with CAM, especially as NACM grows and we're adding more staff, thinking about like, how do our different staffs interact with each other? How do the different boards interact with each other? Who are we accountable to? And how are we working together as an organization, an Indigenous organization that, to the best of our ability, tries to always follow Indigenous ways of governance, to like, how are we fitting in when we're in a relationship with an organization that is not following Indigenous ways of governance? And, we're having to think about how we change those governance and those modes of governance. And it's not easy to do. And it takes, I think, a lot of time and a lot of thinking and working through different policies. And this was an example of just like the ways that these issues affect like even just like everyday little, or it's not really little policy, but everyday policies, and how we need to be actively resisting these things all the time. And these take time, right? So we put forward this policy and then we had to wait. We had to go back and say, this is not okay. We need to change it. It's going to take time. It took another, I want to say 5 to 6 months before we came back to it, like before it was able to come back. And even then it was like, when it came back to the next meeting, we found other problems. And so I think, these things really take time to work through, but you have to commit the time, because otherwise it's really easy to just continue to push them off and say, oh, we'll deal with that next time. And not let the idea that these things take time, prevent you from starting them, right? Or that the work seeming so large makes you kind of put it off and procrastinate from dealing with these issues, because they're issues and things that need to be dealt with right away, because really we see them as inhibiting the growth of Indigenous midwifery, which is inhibiting and contributing to poor health outcomes. So
can I jump in for a second?
Of course.
Just to demystify for people who aren't like intimately aware of the gray zone of the structure. So NACM's totally autonomous and self-governed, but they're not incorporated, and CAM's incorporated. And so the way that we work together on paper is that, for example, if NACM signs a contribution agreement or something, CAM is in partnership there, and then money kind of flows through a CAM account and then goes over to NACM for their management. But then from a HR legal perspective, it looks like we know the accountability of NACM staff is to the NACM core leaders, but from a legal perspective in Quebec, it looks like those NACM staff are actually under Tonya and CAM. So that's what we're talking about, just to get really granular when we talk about what we're navigating in the gray zones.
Yeah, and I think it's really important to talk about those specifics, because, and as you said, Alix, to demystify it, because this is one of the ways that NACM has really been able to, I think, one of the things that has contributed to NACM's growth, along with like all of the hard work of NACM staff and NACM members. And, I think we talk a lot about how the relationship between CAM and NACM is mutually beneficial, right? And this, I think, goes back again to what Nanki was talking about a little bit in terms of it's not charity, right? Like CAM isn't doing these things, out of benevolence or charity to NACM, but in understanding that this is one way to be an ally, and one way, and what CAM can do as the type of organization it is to lift up Indigenous midwifery, and what their role is in supporting the growth of Indigenous midwifery, which will ultimately improve health benefits and health outcomes for all of our communities. And so, one of the things we wanted to do with this presentation was to really encourage people to think about what are ways that you as an individual person, or you as part of an organization, could partner in similar ways and work through some of these issues that CAM and NACM have worked through with an Indigenous organization, or with another organization who is in your community. And I think like one of the really important things that we have learned over time is the importance of the relationship, and how the relationship has come to be between NACM and CAM, and the amount of time it takes on both parties' part to make that relationship, to make it work, and to really be open to learning new things, and learning new ways of doing things, and to listen to other people. I feel quite comfortable as NACM co-chair saying, nope, that CAM policy, that doesn't work for us. That's not how we work. We need to rethink this. Or for CAM to come to us and say, do you want to partner with us on this project? And our ability to say yes or no. And so, we're both equal leaders in the relationship. And I think an important way for people to move forward is to look at other organizations or groups in your community who also might who you might be able to form a mutually beneficial relationship with, and to reach out to those organizations, but to know that to get to the point of the relationship that CAM and NACM have takes time, and it takes learning and making mistakes and working things out together.
Yes, I want to really talk about, and Nat really stressed this to me. Yes, CAM and NACM have an organizational relationship. They have a memorandum of understanding from 2017 that outlines how that looks in a legal kind of sense, a structural sense, but it's individual relationships. And you can't just assume that CAM and NACM have this relationship that's good and it's going to keep going good. So when I stepped into my role, it was really clear, like I had to build a relationship with Claire as an individual, because the bigger structural relationships depend on that. And I think when we talk about our personal learnings, you know, Claire has talked about that you're going to make mistakes. And I think, you know, on the settler side of things, it's a lot of humility. Like I screw up all the time. I put my foot in my mouth all the time. But, you know, they don't owe this to me, but Claire and Nat and Carol have been really gracious with me in that they point out my error, and I go away and I do my work and I think about it and I read and I do my workshops and I come back and I try and get it right. And so if you bail the first time that you mess up, you're going to get nowhere, like absolutely nowhere. You just have to keep trying to, you know, be humble and be a continuous learner and grow. So I think that that's a really key personal learning for me, is not getting defensive and knowing they're going to make mistakes and building those personal, like one-on-one relationships.
So I think we're coming to our question time. So maybe we'll leave some space for questions. And if there's not questions, I'm sure Alix and I can continue talking.
I just want to say thank you for your sharing, both Claire and Alix. Oftentimes we get stuck at we have information of our history as well as current harms that we perpetuate, and people get stuck often at the how do we, and I really liked Nanki's phrase of be an active opposition to the systems and the systemic racism, anti-Indigenous racism that are experienced. So I think that this was a great example for people to dive into. For folks who are interested in sharing a question, please do in the chat. I'm going to go through it now and share some of the comments and questions. The ICM position statement has been shared, it looks like a few times, so thank you. Someone echoed a comment about don't wait until you're comfortable. Someone shared equity feels like oppression to the privileged, and they weren't sure who to credit, and that's a Twitter quote from 2015 from someone named Franklin Leonard. And so social media kind of ran with that and it gets lost in the fray. So thank you for sharing that. Alix, you answered the question as well as Claire about the examples of why folks didn't support the position. There's a comment about how important it is at the provincial level, local level, hospital level, as well as the international and national levels. And this is a great example of talking about the work that was both locally and nationally impacted, as well as on the national level, or global level rather. Someone had a question about such an effective tool at shutting down conversations. So this is going back to the conversation about the ICM position statement. Can you explain more? Can you define what you mean? And can we have that in writing? And where is the evidence? So they're kind of fleshing out some questions. Did any of you want to kind of take a look at that in that sense of what you meant by the shutting down of conversations?
I think the moment that came up was in response to ICM asking us to define Indigenous midwife. I could be wrong, but I think that was the context of that being a delay tactic, as well as that asking for the evidence, right? This isn't broad enough. This is too Canadian focused. There's show us more evidence on the benefits of Indigenous midwifery.
There's another comment that's, I imagine there is a difference between how provincial associations react compared with provincial colleges. They will say they have to uphold the law, which is founded on the medical model. I'm curious what that particular comment, is that something that you've experienced in seeing the differences between associations versus colleges and how they respond to anti-Indigenous racism or the work that you're experiencing?
Sorry, was that the question?
No, they were making a statement.
Oh,
and
okay.
I was curious.
It's pretty hard when you can't see the question.
That's why I'm trying to say them out loud.
So, I mean, no, I get it. Sorry, Trish. So, I mean, I think one of the things that is important to talk about in relation to this is that, like, we're talking about changing the system, right? We're not talking about, like, Nanki said this as well, right? We're not talking about little tweaks to the system. We're talking about changing an entire system of how we work, and also trying to get people from incredibly different world views to understand each other and to see how the other worldview functions. And it's like, so it takes time to do those things, and it actually takes spelling those things out for people to be able to really, I think, see what the issues are and to be able to move past them, or to move through them. And that, and so, like, you do come up against lots of barriers because people don't want to change the system, or they think it's too difficult to change the system. But we have to, because it's not working. And like, this isn't just systems that aren't working and it's not great, like, they're not working, and Indigenous people are paying with their health outcomes and their lives. And so these are incredible things that need to change. I also just want to acknowledge that Evelyn Harney is somebody who has made that point quite clearly, and I want to acknowledge her work in this. And so we need to make things uncomfortable and change and work through that uncomfortableness, and really change the system and change how things are functioning, because little tweaks aren't going to make the difference that we need.
Full agreement. We have about a minute or two left, so I will see what other question there might be. Again, you might notice the pop-up will come up shortly for you to provide feedback. There are some acknowledgements and thank yous about the presentation and the efforts behind the presentation, and sharing some behind the scenes of how NACM and CAM have worked together. There's a comment that says, my sense is that the number of Indigenous midwives in each province and territory are still too small to have separate Indigenous midwifery organizations at that level. So I guess a more local provincial level. Have NACM and CAM thought about how to support provincial and territorial midwifery organizations in this work if there is no counterpart Indigenous midwifery organization to partner with?
So I think that's a really interesting question. And while I do think that there is a role for NACM and CAM, I might turn it around and say, have those provincial organizations thought about reaching out to individual midwives in your, or midwifery or Indigenous communities in those provinces, and kind of turn that thinking around a little bit. So because I think it's important to participate in a local level. But I will also say, I do also think that there could be a role for CAM and NACM in supporting that work. And maybe I'll give it over to Alix there.
It's not my own idea. I believe it's credited to Carol, though maybe also Evelyn, but I think it was Carol who suggested that in the same way that CAM is a confederacy, and that each member association from every province and territory, as well as SMAC and NACM, come together at the CAM table, that it might actually work to link up with NACM and kind of have like a similar NACM structure, maybe not the same confederacy governance, because heaven knows there's problems with that very colonial model of governance, but I think that would be really helpful, and also provide some important independence where sometimes power dynamics play out when there's an Indigenous committee of regional association. there is a time and a place for that too. You know, I think at CAM, we like to be in a place where we have bilateral relationships with other organizations, but we recognize we can't wait until those groups are ready to make a change. And we can't put all that weight of the unpaid labor on those groups. So I think that's another dance that we're always doing.
I do also just, I know Trish is going to cut me off. So I'm just going to quickly say, you know, midwifery, Indigenous midwifery is small. The number of Indigenous midwives is small. We're growing hugely, but and other provincial associations are small as well too. So I understand that that's like, it's a lot to ask people to take on, but I think it's crucial work that needs to happen if we're really going to grow our numbers for both, you know, Indigenous midwifery and non-Indigenous midwifery. So I do think there's ways that we could think as organizations, CAM, NACM, and provincial associations, of how we could support each other.
I think what's really evident is that there's a lot of work still to be done from non-Indigenous midwives, supporting Indigenous midwives on all sorts of levels of government and global as well as national. So I want to thank Alix and Claire for sharing their time with us for this session. Please join us in the lunchroom for some discussion with your colleagues and peers, and thank you.